had a bridge, a very old bridge that had been there for a long time, and coupled with bone loss and getting infected down under the bridge, so that it was not going to be possible to keep that bridge. I was going to have it out. Because of the expanse there, how big the area was, my options were more limited. I could have a bridge that came in and out. My other choice was to look at dental implants. I would be able to have implants that would be permanent in, not coming in and out, and not having a big open place in the back. After the implant process and the crowns were in, I'm able to eat anything. Before that, I had to be very careful chewing, especially meats. Now I can have steak, pork chops, anything I want to eat. There's no sensitivity there. Everything fits exactly right, perfectly right, and I'm a happy camper.